As summer approaches, a lot of us go outside to play, and with that comes an increase in physical injuries, including injury to the eyes. You should know Dr. Brent Reed, the ophthalmologist from Griffin and Reed Eyecare. He joins us now. Always good to see you, doctor.
You too, Dan.
What kind of injuries do you see occur more often in the summertime?
Well, usually they're due to two things. One is people are out doing sports more than they ever have, or during the wintertime. And you see a lot of sports injuries that are related to various sports. The other thing that you see a tremendous amount of is when people go out to clean up their property and they're doing yard work for the first time through the winter. Weed eater injuries with eyes are terrible, just terrible. And sometimes lawnmower injuries as well occur from flying objects coming out from the lawn that hasn't been mowed or taken care of very much for the wintertime. So it's those cleanup injuries. People should really wear safety glasses even when they put nails in a fence, because some of the worst injuries I've seen in my career are nail injuries from people being hit with flying nails, pieces of nails.
No, you mentioned the weed eater. That's the one that really gets me. You'll be out there and you're thinking all you're trimming is grass, and all of a sudden you see a piece of tree or something come flying up. You see what happens when it goes that way.
Well, if they ever hit you in the face, or if you look at your shins after you've done it, you see all the marks on your legs. Those flying objects come off there at very high speed. If they hit you in the eye, they can blind you.
Okay, so we talk about the goggles. Also, in the summertime, since we're outside so much more, I would assume sunglasses are just basic.
Sunglasses are a great idea, and people should wear UV protection when they're out in the sun long enough to get a little color in their cheeks. Just because the UV will cause changes in yellowing in the lens in the eye over the years, developing cataracts, it also increases the risk of macular degeneration as we get older, and it's a cumulative thing over a lifetime. So the more UV protection you get, the better off you are. And we should look at that for our kids, too.
Any other tips in terms of preventative measures that we should keep in mind?
Well, we're coming up on the 4th of July, and every year about 2,500 people suffer severe eye injuries due to fireworks. And it's mainly illegal fireworks, and about half that number that suffer those injuries are blinded by those diseases. This is actually a graphic that we show of an injury that occurred because of a blunt trauma, a blowout fracture of the eye where the bone below the eye is actually blown out, the muscles entrapped so the patient can't move their eye, and you see that there's actually air underneath their lid. It's called orbital emphysema, and that's a common blunt trauma injury. This is an injury to an eye where a patient's been hit hard by a ball and was not wearing safety glasses or some kind of eye protection, and the iris is torn. This is what happens in the back of the eye. The same thing happens: retinal detachment, swelling, bruising in the back of the eye can occur just like it does on the face, but it's devastating.
Ooh.
This is a typical raccoon injury from someone being hit in the nose and or the eye. The bones around your eye are designed to protect your eye, and they do a pretty good job at it, except in the case where the ball is smaller than the orbital opening, and that's particularly racket sports. One other thing, quickly, paintball injuries are absolutely devastating. People that don't wear eye protection that's appropriate when they're playing paintball, they're crazy.
You've got to do that. Hey, before we wrap this up, let me ask you, the new craze among professional athletes, these tinted contact lenses, I guess they're amber to make the ball stick out more. Is there some logic to this?
It does. It does increase the contrast sensitivity between the ball and the background. And I guess if you're seeing a 95-mile-an-hour fastball coming at you, I would want to see that well too. For most people, it's not going to make any difference.
Okay. Always good to talk with Dr. Brent Reed.